Today we will be manual muscle testing the lower extremities. A grading scale of 0 to 5 will be used when manual muscle testing. 0 out of 5 is absence of muscle contraction. 1 out of 5 is the ability to produce muscle contraction without joint movement. 2 out of 5 is muscle contraction caused by complete joint motion without resistance of gravity. 3 out of 5 is muscle contraction with joint motion and with gravity. 4 out of 5 is muscle contraction causing joint motion against gravity withstanding moderate resistance to an isometric contraction, yielding against normal resistance. 5 out of 5 is muscle contraction causing joint motion against gravity and maximal resistance to an isometric contraction. When manual muscle testing, the patient will resist at a point of contact upon clinician's cue, hold, don't let me move you. When performing, it's important to consider proper body mechanics as well as patient comfort. Towels, pillows, and form blocks are various forms that may be used.
The iliopsoas muscle. This muscle flexes the hip. To test this muscle, place patient in supine position and bring one leg up to the 90-90 position. Apply pressure to the top of the knee, trying to force patient into hip extension.
Hold this position right here. Don't let me move you. Relax.
The sartorius. This muscle does a combination of hip flexion, abduction, lateral rotation, and knee flexion. To test this muscle, lie patient supine with legs in figure 4 position. Apply pressure just proximal to the knee, trying to force patient into hip extension, adduction, and medial rotation.
Alright. Hold. Don't let me move you. And relax.
The gluteus maximus. This muscle extends, hyperextends, and laterally rotates the hip. To test this muscle, place patient in prone position, bringing their hip into hyperextension. Apply pressure just proximal to the knee.
I want you to hold this position right here. Don't let me move you. Relax.
The gluteus minimus. This muscle abducts and medial rotates the hip. To test this muscle, place patient in sideline position, straightening the top leg and bringing it into slight abduction and medial rotation. Apply pressure just proximal to the knee.
Alright. Turn that foot in. Hold this position right here. Don't let me move you. Relax.
The gluteus medius. This muscle abducts the hip. To test this muscle, place patient in sideline position, straightening the top leg and bringing it into abduction. Brace patient right above the hip to keep them from rolling back as you apply pressure to the proximal knee.
Alright, I'm going to bring this back and up. I want you to hold this position right here and don't let me move you. Relax.
Tensor fasciolata. Muscle action is to flex and abduct the hip. Lie the patient supine, legs extended with one leg held off the table. Apply inward pressure with one hand to the outside of the leg, just proximal to the ankle.
Hold this position. Hold. Don't let me move you. Good. Relax.
Adductors. Consists of the adductor magnus, adductor longus, and adductor brevis muscles to adduct the hip. To test, have the patient lying away from you and flex the top of their leg at the hip and knee to expose the bottom leg underneath. Have the patient hold their bottom leg straight and off the table as downward pressure is applied with one hand to the medial thigh, just proximal to the knee.
Should I bring this leg forward for you? Don't lift this leg. Hold, don't let me move you. And relax.
Medial rotators. The gluteus minimus muscle internally rotates the hip. The patient should be lying supine with the hip and knee of one leg flexed to 90 degrees. When testing, place one hand on the lateral aspect of the lower leg, applying inward pressure, and while the other hand is applying outward pressure placed on the medial aspect of the knee.
Hold. Don't let me move you. And relax.
Lateral rotators. Compromise of the piriformis, gemellus superior and inferior, obturator internus and externus, and the quadratus femoris muscles to externally rotate at the hip. Place the patient lying supine with the hip and knee of one leg flexed to 90 degrees. To test, place one hand on the inside of the lower leg, applying outward pressure, and the other hand on the outside of the knee, applying inward pressure.
Hold. Slowly move you. And relax.
Rectus femoris. Muscle action is both hip flexion and knee extension. To test, have the patient lying supine, holding one leg off the table, flexed at the hip with knee extended, and apply downward pressure at distal end of femur, proximal to the knee.
Hold your leg for me like this. Hold, don't let it move you. And relax.
Quadriceps. Composed of 4 muscles and identified by their location on the femur. The vastus lateralis, vastus intermedius, and vastus medialis, with the rectus femoris lying superficially, all work together to extend the knee. Move the patient seated to the edge of a table and place one hand on the distal tibia proximal to the ankle and apply pressure against the leg.
Press against my hand. Hold, don't let me move you. And relax.
Biceps femoris. Muscle action is hip extension and knee flexion. Have patient seated and place a hand behind the lateral aspect of the leg, just distal to the knee. Hold as the patient pulls against your hand, using your other hand over the knee for support.
Hold your leg there. Pull against my hand. Hold, don't let me move you. And relax.
Semitendinosus. Muscular action is to extend the hip and flex the knee. With patient seated, place one hand behind the medial aspect of the leg, just distal to the knee, and hold as they pull against your hand.
Hold your leg like this for me. Pull against my hand. Hold, don't let me move you. And relax.
Semimembranosus. Muscle action is to extend the hip and flex the knee. Have the patient seated at the edge of a table and place one hand behind the medial aspect of the leg, just distal to the knee. Hold as they pull against your hand, placing your other hand over the knee for support.
Hold your leg like this for me. Pull against my hand. Hold, don't let me move you. And relax.
Gastrocnemius. Muscular action of the gastrocnemius is to flex the knee and plantar flex the ankle. To test, have the patient seated at the edge of the table and place one hand under the pad of the forefoot and apply upward pressure, placing the other hand above the knee for support.
Hold your foot for me there. Hold, don't let me move you. And relax.
Tibialis anterior. The action of this muscle is dorsiflexion of the ankle joint and assists in inversion of the foot. To test, the patient can be in supine or sitting. One hand is supporting posterior to the patient's ankle, while the other hand is on the medial dorsal surface of the foot. Then apply pressure in the direction of plantar flexion of the ankle joint and eversion of the foot.
Hold, don't let me move you. Relax.
Tibialis posterior. This muscle inverts the foot and assists in plantar flexion of the ankle joint. To test this muscle, the patient can be in sitting or supine. Have one hand for support posterior on the patient's ankle, while the other hand is applying pressure against the medial side of the plantar surface of the foot in the direction of dorsiflexion and eversion of the foot.
And hold, don't let me move you. Good, relax.
Peroneus longus. The action of this muscle everts the foot and assists in plantar flexion of the ankle joint. To test this muscle, the patient is lying in supine. Clinician has one hand supporting posterior on the patient's ankle, while the other hand is applying pressure against the lateral border of the foot in the direction of an inversion of the foot and dorsiflexion of the ankle.
Hold, don't let me move you. And relax.
Peroneus brevis. The action of this muscle everts the foot and assists in plantar flexion of the ankle. To test this muscle, have patient lying in prone position with foot off the edge of the table. One hand should be on the calcaneus to resist the upward pull, while the other hand is on the lateral forefoot, applying pressure into dorsiflexion and slight inversion.
Hold, don't let me move you. And relax.
Flexor hallucis longus. The action is great toe flexion and assists in inversion and plantar flexion of the ankle. To test this muscle, have your patient supine or sitting. Stabilize the MTP and ankle in a neutral position. Flex the IP joint of the great toe. Apply pressure to plantar surface of the distal phalanx in direction of extension. Hold, don't let me move you. And relax. Extensor hallucis longus. Its action is to extend the first toe, assists in ankle inversion and dorsiflexion. To test this muscle, have your patient supine or sitting. Stabilize foot in a slight plantar flexion. Extend the MTP and IP joints of the great toe. Apply pressure to dorsal surface of distal and proximal phalanges of the great toe in the direction of flexion. Hold, don't let me move you. And relax. Flexor digitorum longus. Its action is to flex the four lesser toes, assists in ankle inversion and plantar flexion of the ankle. To test this muscle, have your patient supine or sitting. Stabilize metatarsals and maintain neutral foot and ankle. Have patient flex the DIP joints 2 through 5. Apply pressure to plantar surface of distal phalanges in the direction of extension. Okay, bend your toes in. Hold, don't let me move you. And relax. Extensor digitorum longus. Its action is to extend 4 lesser toes and assist in ankle dorsiflexion. To test this muscle, have your patient supine or sitting. Stabilize foot in slight plantar flexion. Extend all joints of the 2nd through 5th digits. Apply pressure to dorsal surface of toes in the direction of flexion. Okay. Put your toes up. Hold, don't let me move you. And relax.